Hello, my name is Ibrahim Adam. I am a practical nurse learner from Bovary College, and today I'm going to do my lab assessment for Nursing Foundation 3. This is the ID, the back side, and then I'm going to take 360-degree scan for the room. This is the area where I'm just working. Okay, so I'm going to start with hand sanitize. And then show my papers. Next step is I'm gonna read my scenario. Patient name is Steven Deep, male, hospital ID 100245629, date of birth 1980, November 29. You are the practical nurse learners caring for Deep Steven. Deep was admitted to your unit following abdominal surgery and chest tube insertion. The time is 10 and Deep's abdominal packing wound is due to be changed. Okay, this is the scenario, so I'm gonna put it away. The next one is I'm gonna read the doctor's order. Patient name is Steven Deep, male, hospital ID 100245629, date of birth 1980, November 29, and admitting diagnosis penetrating abdominal trauma, pneumothorax, surgical procedure, laparotomy, wound debridement, chest tube insertion, allergy, no known allergist. Goal of care is everyone. Activity for today, it is abdominal wound packing. Status is active. Action, irrigate abdominal wound with 0.9% sodium chloride. Pack abdominal wound with 0.9% sodium chloride. Soaked half-inch wide plain packing strips once a day in PRN. Okay. Once I read my doctor's order, so I'm gonna just collect my supplies. Okay, those are my supplies, and all of my supplies are reusing them, and they are not intact, but all of them are not expired. So, okay. So I'm gonna go ahead and do the process. So the next step is I'm going to just go to the doctor's and go to the patient room. So this is my supplies. Before that, I'm gonna do my street checking is on my normal saline and steri strips. So these are my stuff, and I'm gonna do 3 checkings. First on normal saline. Okay, patient name is Steven Deep, male, hospital ID 100245629, date of birth 1980, November 29, and action is irrigate abdominal wound with 0.9% sodium chloride. And no patient information on this one. In my hand I have 0.9% sodium chloride. Expired date is January 21st. Open today at 7 in the morning by me, and which is good to use, and I'm going to use it to irrigate the abdominal wound of Mr. Deep until it runs cleans, and to soak the steri strips. First check. Second check, Steven Deep, patient name, date of birth 1980, November 29, action irrigate abdominal wound with 0.9% sodium chloride. No patient information on this one, but in my hand I have 0.9% sodium chloride. Expired date is January 21st. Open today at 7 in the morning by me, which is good to use, and I'm going to use it to irrigate the abdominal wound of Mr. Deep until it runs cleans, and to soak the steri strips. And then my second check, my third check, patient name is Steven Deep, date of birth 1980, November 29. Action irrigate abdominal wound with 0.9% sodium chloride. No patient information. In my hand I have 0.9% sodium chloride. Expired date January 21st. Open today at the 7 p.m. a.m. in the morning, which is good to use, and I'm going to use it to irrigate the abdominal wound of Mr. Deep until it runs cleans, and to soak the steri strips. Okay, and my third check, Steven Deep, patient name, hospital, date of birth 1980, November 29, action irrigate abdominal wound with 0.9% sodium chloride. In my hand I have 0.9% sodium chloride. Expired date is January 21st. Open today at 7 in the morning, which is good to use, and I'm going to use it to irrigate the abdominal wound of Mr. Deep until it runs, cleans, and to soak the sterile strips. Okay, my street checking is, next step is this one. Patient name Stephen Deep, date of birth 1980 November 29. Action: pack abdominal wound with 0.9% sodium chloride, soaked half-inch wide plain packing strips once a day in PRN. No patient information. In my hand I have half-inch wide plain packing strips. Expire date is January 21st, which is good to use, and I'm going to use it to pack the abdominal wound of Mr. Deep. My first check. My second check, patient name is Stephen Deep, date of birth 1980 November 29. Action is pack abdominal wound with 0.9% sodium chloride, soaked half-inch wide plain packing strips, and once a day and PRN. In my hand I have half-inch wide plain packing strips. Expired date is January 21st, which is good to use, and I'm going to use it to pack the abdominal wound of Mr. Deep. Third check, patient name is Stephen Deep, date of birth 1980 November 29. Action is pack abdominal wound with 0.9% sodium chloride, soaked half-inch wide plain packing strips once a day in PRN. In my hand I have half-inch wide plain packing strips. Expired date is January 21st, which is good to use, and I'm going to use it to pack the abdominal wound of Mr. Deep. Okay, I've done my street checkings. So the next step is I'm gonna go to my patient room. So I'm gonna go to my patient room, hand sanitize, knock knock. Hello, my name is Ibrahim Adam. I am a practical nurse learner from Bovali College, and today I'm here to do wound irrigation, packing, and dressing change. Can you tell me your name and date of birth? He said Stephen Deep, date of birth 1918 November 29. I'm going to cross check. Patient name Stephen Deep, patient name Stephen Deep, hospital ID 100245629, hospital ID 100245629, date of birth 1918 November 29, date of birth 1918 November 29, which is the right patient. So I'm gonna just go ahead and put my doctor's order away. I don't need it anymore. And the next step is I'm gonna assess my patient. So I'm gonna do my safety check. Before that, safety checks beds, and move the bed to the working height, give privacy, and then put on clean gloves and assess my patient. Okay, so I'm gonna ask Mr. Deep, do you need any anti-pain for the procedure? He says he's good, he does not need it. Okay, so he's just lying this way, so I'm gonna just remove it away from the sides. Date that was changed, it was 29/11/2020, which is yesterday at 7 a.m., which is good to change, and there is some shadowing over the top. And then I'm gonna remove it parallel to the skin. Okay, I'm gonna assess it. Toco, this is 2 4x4 gauze and 1 abdominal pad. So 4x4 is soaked 50% with Cerosanguinus, pink in color and no odor, and abdominal pad is soaked 75% with Cerosanguinus and pink in color. Okay, so I'm gonna squeeze it together and put it in garbage. Squeeze it in my hand and then remove it. This is my garbage. So I'm gonna assess my wound, peri wound. Okay, I'm gonna assess for tenderness and pain. There's no any tenderness or pain. Peri wound, there is no any redness, edema, and ecchymosis. And yeah, so I'm gonna remove this one again this way and then put it in garbage. Hand sanitize. And then I'll just put blue pad under my patient. To catch. I'm gonna tilt it to make it rinse down to the gravity. So the next step is okay. So I've just assessed my patient. Now I can just prepare my sterile field. So to prepare it, first cavity wipe the sterile the table, then open it. Okay, I'm gonna put this one to catch some water, then put it here, and then I'll just rotate this one. And then introduce my abdominal pad and 4x4. Okay, this is not intact, but they are still are. I'm gonna peel it down and then use my blue forceps, and then using the window come out, put in a garbage, open, peel it again, second one, put in a garbage. Okay, abdominal pad, peel it, put in a garbage. So I'm gonna just pour it. So next I'm gonna just introduce this is my scissors and forceps, extra forceps for cutting the steri strips, keep the sterility of the tip. This one too. Okay, this is gonna go garbage. Next one, I want to just introduce this one too. So now I can just remove it, just put on clean gloves and remove the okay, so I can just remove the steri strips. Okay, this is 20 centimeter fully soaked half-inch wide steri strips with zero sanguinous, pink in color, no odor. So I'm gonna put in a garbage. This is gonna go garbage together, and then I will just, you can measure it first, side lengths and widths. Okay, length is 3.5, width 3.5. That's good. I'm gonna put it this one and then measure the depths. Use cotton tip applicator. Keep the sterility of the tip. Soak it. And then gently assess for the tunneling or undermining, and then finally measure the depths. Okay, so measure with this one. It is half centimeter. It's gonna go garbage. This is gonna go garbage too. So now I can just irrigate the wound. So I'm gonna open it. It is not intact, but this is like, this is a 50 ml syringe. Ideally I have to use it 30 to 50 ml with a 19 gauge angiocatheter, but for now I'm going to use it, this one, because this is not have a Luragroc for anything. So I'm gonna put it this way, down, put it, keep the sterility of the tip, remove the tip, and then pour it. Okay, so I'm gonna just irrigate it with the pressure PSI of 5 to 15 PSI. Irrigate from top to down until it runs clean. Okay, zigzag. Okay, it is running clean now, so I'm gonna put this one to garbage. And then I can just remove this one now. From inside. And do hand sanitize. And then cut my steri strips. put it back. Okay, close this one. Then now I can put on my sterile glove and then start cleaning. Okay, this is not intact, but it's not expired. Okay. Put in the garbage, and then now I'm sterile. Tuck my hands. Then I will start cleaning. Make it pillow. Squeeze it. Okay, clean the periwand, nearest one. Toss it. Second. Squeeze it. Clean further away. Put it in. Further, much further. Then close it. So now finally I want to just try. Toss it. Then I'm done with this one. Now I'm gonna just clean. Put this one over here. Try it with the hand. And then tuck it, pack it inside without touching the edge. Okay. Then finally put this one So after I cleaned it, I just let it for air dry. Don't forget that one, it is dried by air. So I'm gonna put these two 4x4 together. Okay, now I don't have to be with this one over the top. Now I don't have to be sterile anymore, but I'm gonna tape it. Tape it with 1 inch. Then the middle. Now what is left is just right there in time. I'm gonna remove my gloves. Put in a garbage and sanitize. And then dead in time. Dead in time. Today's date is November 30, 2020. Time is 10 in the morning. Initial Ibrahim Adam PNL. Okay, now what's left is retouching. Please let me know if there is any pain or discharge coming from the incision side, from the wound. Take more liquids or fruits and take 1 extra service of protein. And here's the call bell. Call me if you need it. And then put the bed to the lowest level, undo the curtain, hand sanitize, and put on clean gloves, and then clear the wrists. Okay, so I'm done. I'm gonna the sharp container, go to the sharp container. Already switched.